Hi, everyone, and thanks for joining. My name is Arisha Hatch, and I'm the Vice President and Chief of Campaigns at Color of Change. And I'm here today with Dr. Ruth Arumala to discuss the COVID-19 pandemic and the vaccine distribution that's happening. Dr. Arumala is a Texas-based physician. I'm a Texas baby. Who takes a patient-centered approach to care. She seeks to empower her patients to make healthier choices that enable them to live a happier, more fulfilling life. And in partnership with Color of Change, Dr. Ruth authored not one, but 2 volumes of our Black Patients Guide to COVID-19 that you can find at www.theblackresponse.org for more information. Today, Dr. Ruth has come back to join us to give us more updated information, to talk a little bit about health equity for Black communities and to cover so many topics that were outlined in this recently released 2nd volume. And we really just want to have a discussion about tips for Black women who are expecting and thinking about getting the vaccine. Dr. Ruth, it's so great to be with you today, to join you today.
It is my pleasure. I am so excited to be here. This is my passion, talking about how we can make healthcare work for Black people. So I'm excited to be here.
Thank you so much. And, it's obviously, doctors are always first responders, but have become first responders in this day and age. What made you decide to become a physician?
So my mother is a physician, and so I saw that growing up, and I saw how she was able to balance being a mother, a wife, an entrepreneur, and a physician. And I thought it was a beautiful thing. But I didn't want to be exactly like my mom. Everybody, you want to forge your own path. So I actually thought I was going to do public health first. And my focus was on health literacy, and I focused on improving health for Black people. And I wanted us to know more about our bodies, because if we know more about our bodies and we know what can go wrong with our bodies, we're empowered to make better decisions. And that's how I started out. But when I was in public health school, I was doing my MPH, I realized that it is kind of hard to know how to manage the population when you don't understand the disease. I had no idea what chronic hypertension was or what diabetes was, but I knew how it worked in the community. And I thought, no, I want to be an expert. And that's actually how I made my decision to become a physician. I wanted to get into a position where I knew the ins and the outs and the pathology, the pathophysiology, how it affects patients, the prognosis. That's what I wanted to know. I wanted to be the end all. And so there's a part of a altruistic part of it, but there's also an intellectual stimulation. I wanted to be, intellectually stimulated too. So I think that's where your passion and your purpose kind of meet. And that's why I decided to become a physician.
I love that. How do you see the role of Black medical providers such as yourself in helping to address this pandemic and health equity for Black communities?
I think that there is such a burden on Black physicians as never before. I've never seen a situation where we're so diverse and we are starting to come into our own as Black physicians, not necessarily only trained by Black medical schools and postgraduate programs, but being trained by everyone and being given the opportunity to give back. And I think giving back for a Black physician is so much more than other races because we are so little. Black people are about 12% of the population and 2% of Black women are 2% of the medical field, 5% of the medical field as Black female and male physicians. So we are disproportionately represented. And so we have this burden to not just ensure that people that look like us are offered the best quality, best evidence, loving healthcare, but we're also giving back to the next generation after us. So I think that I encourage Black physicians to continue to not just take care of their patients one-on-one, but to continue to create tools that can help people on a broader platform. And that's one of the reasons why I partnered with Color of Change, because I wanted to let my voice be heard beyond the patients that I deal with one-on-one, and to actually make an impact on people who might never meet me, but would love to hear a physician that looks like them give her educated opinion about COVID, how to seek care around COVID, and whether or not the vaccine really is it safe? Does it really work? Should I really get it? When I get it, how do I behave and how do I move in this new world, our new normal? So I wanted to be part of that.
Mm-hmm. And I think it's just so important. My family and so many Black families have been especially touched by COVID. I lost my father very early on during the pandemic. I know it's so important for us to have messengers that we trust, to be able to go to a doctor. You know, doctors have been in the Black community, doctors have not always been fully trusted. And so I think it's so important what you're doing. And I'm so thankful that you're here, to share all this great news with us. Can you talk just a little bit about how and why Black people, Black families have been so affected by this pandemic, or, at what rate compared to other folks?
Yeah. COVID magnified the systemic disproportion or disparities in healthcare. It just magnified it. We've had this all along, but there was an ability for healthcare to blame the Black patient. So you could say, oh, you have diabetes because you're overweight. Oh, you have hypertension because you're obese. Oh, you have this or that or this or that because of your behavior, not because of the system, not because of your access to care, not because of your access to quality care, not because of your underinsured situation, right? But COVID now is something that kind of equals the playing field. It's not a behavioral thing. I mean, it does have some behavioral components, but it's a virus that's novel, that has affected everybody and came out of nowhere. And it still disproportionately affects Black people. So why is that? Mm-hmm. That's what we as healthcare professionals and public health professionals have to now imbibe. Why is there this disproportion? There have been a lot of theories, and I say theories because none of them are proven. One of them is, if you have underlying health conditions that are exacerbated because you have a healthcare system that's not created for you, we have to realize that healthcare in America was not created for Black people. That is not me saying that. That is what history says. Because if you go back and look at the older textbooks, a lot of the times, or even if you look at the Flexner report, which was made by Abraham Flexner about medical schools and postgraduate programs, they actually closed down a lot of Black medical schools at that time, leaving just Meharry, Howard, and Morehouse. Mm-hmm. And so the system is not necessarily created for us. That's why I said in the beginning, Black physicians should help Black patients let the system work for them. It wasn't a system that was created to include and take care of Black patients.
Well, we definitely started out this pandemic with memes on social media about how Black people were somehow immune to this pandemic. And we know that couldn't be further from the truth. I think what we've also seen in the work that we do, the people who are also impacted are those who don't have the privilege to work from home all the time. They had to go out and make sure that they could continue to put food on the table. And so we're here to help folks navigate. Now, as the pandemic's gone on for a while, we've heard about all these variants. what COVID-19 symptoms should we still be looking out for? And what should we do? What should someone do if they feel like their symptoms aren't being taken seriously by their healthcare provider?
So it still remains a predominantly respiratory disease. So I stress the idea that you should know your body, your norm. So if you're starting to get away from your norm, it's concerning, right? Are you starting to get short of breath easily? Are you tired easily? Things that you could do easily, you can't do anymore. You are losing the sense of taste and smell. That is really important. It kind of is a differentiator from other viral diseases at this point. You start having fevers, chills, you're having difficulty breathing. Difficulty breathing is actually a very concerning, alarming symptom. So if you have difficulty breathing, or someone that you love or you care for has difficulty breathing, that is alarming. A lot of the times, COVID is still asymptomatic in a lot of people, but that's actually more of a scary thing to me, because if you're asymptomatic, you're able to spread the disease without actually knowing you have it. And you could spread it to someone who's more susceptible than you, and but you still, and I've witnessed that a lot. I've had people that I know, patients that I know who have contracted COVID, were asymptomatic and spread it to people who have died. And so it's very concerning. So that's the first part. The answer to your second part of your question is, if you suspect you have COVID, call your primary care physician. And many of you are going to look at me and say, I don't have one. Problem number one, you have to have a primary care physician. Period, point blank. We're not wrestling about that, because you have to have somebody that you can call to ask who navigates your healthcare for you, who's the quarterback of your healthcare. Because I say every single patient is the CEO of their healthcare, but you have to have people who know the ins and the outs of different things to help you navigate through your body and your healthcare. And I think, I'll take a step back and say that as Black people, we have to know that health is our wealth. Being healthy, you're able to go out and get it. Go out and get that money. Go out and get that promotion. Go out and take care of your family. Go out and change the world. But if you're not healthy, you can't do that. Okay. So you need a primary care physician. So you will call your primary care physician and say, these are the symptoms that I'm experiencing. If your primary care physician says, oh no, that's just the flu. Oh, it's just a stomach flu, get another one. Because you have the you're the person that's paying for this insurance. Even if you think you're not paying for that insurance, it's coming out of your paycheck. So that is how you should navigate this. Okay. Insist on your care. I want a test. I need to know for sure. It's okay to be reassured by the test, but it's not okay for something to be brewing underneath and not uncovered early enough for us to start to treat a situation. If you are short of breath, don't pass go, don't collect money, don't go to jail, go straight to the ER. Explain to them that you think you have COVID so that they're gowned up. Don't hide it. That's one thing you should not do. Do not hide your concern about COVID, because you allow the healthcare providers to also insulate themselves with a second layer of protection so that they're able to take care of you and other people. That's the kind thing to do. And then, so that would be my two things. If you have mild symptoms, you call your primary care physician. If you don't have one, get one. And then if it's a shortness of breath or you become unresponsive, clearly that's going to be 911. But you need to go to the ER. That's my recommendation.
Thank you. And I think it's so important what you said, making sure you have a primary care physician to allow them to advocate for you. Like, this is a complicated system that we're living in, and the right doctor should be someone who's helping you navigate that system. If they're not doing that, if they don't take you seriously, like, use your power, whatever power you have, and find a new doctor is what I'm taking away.
Yes.
Can we talk a little bit about the vaccine? You know, this vaccine has been turned around, I think, faster than so many people were predicting, say 9 months ago or a year ago. And there are people with valid concerns possibly about what the long-term impacts or implications on this. And Black women especially have, if I, Black women especially Black women who might be considering giving or in the process of giving birth, currently pregnant, thinking about getting pregnant, might have real concerns about this vaccine. Maybe there is a mother that's breastfeeding. What advice are you giving to Black women who are expecting or planning to become mothers soon, or who are already mothers, about how safe the vaccines are?
Okay, I love this question because I get it every day. So let's back up a little bit and talk about why this vaccine was accelerated. We know a lot about the coronavirus family. I remember being an undergrad learning about the coronavirus family. So we know a lot about that. The second is we know a lot about mRNA vaccination. So the infrastructure was already there. And the third thing is that because of the government's interference, which was a good thing, interference sounds like a harsh word, but intervention, a lot of red tape was cut in that they didn't have to do the steps that you need to do, the bureaucratic steps, not the scientific steps, but the bureaucratic steps to get the vaccine. That's why they say the vaccine was fast tracked in a bureaucratic way, not in a scientific way, because scientifically, we already had this infrastructure, this technology that was already open. If I listened to an interview of the CEO of Moderna, and he talked about how Moderna was actually, he's like, I don't know, 13th, don't quote me on that, but some crazy number of company that he's created, and that it was created specifically for mRNA vaccinations. It just happened to come into like its place because you never really heard about Moderna before, but because now we needed an mRNA vaccine, and that's all they did. That's all they did. So as for that's the background of why the vaccine was accelerated, okay? And then, is it safe? For a general population, is it safe? I would say a resounding yes. I received my vaccine in December. First one, I did Pfizer, and my second dose in January. I am so confident about the safeness of this vaccine. Now, you might say to me that you've seen people on TV who seem to have gotten facial paralysis after getting the vaccine. That's called Bell's palsy. It's a transient, most of the time, it's a transient paralysis of the facial nerve. And that happens with any vaccine, including the flu vaccine, in a very small select population that's susceptible to it. And usually you gain it back. Okay. So and you can actually get it from getting a viral infection. It's actually a higher number than get it from actually getting the infection, not the vaccination. That being said, let's talk about pregnancy. I want to kind of talk about three types of women: women trying to conceive, women who are currently pregnant, and women who are breastfeeding and postpartum. So, is the COVID vaccine safe? Yes, yes, and yes. And this is not just me saying that. These are all the respected bodies who have looked at the literature and looked at the pros and cons. In medicine, all we do is do a risk benefit analysis. Whenever what is the risk of this thing? What are the benefits of this thing? Do the benefits outweigh the risks? Great. We're going to go that way. Do the risks outweigh the benefits? Then we're going to go no. So the benefits of getting the COVID vaccine are so much more. In fact, when you're pregnant, there's a postulation that antibodies can actually cross the placenta and protect your baby. So that's a good thing. The vaccination has not been shown to be transmittable in breast milk. So it's not really harming the baby, neither is it really helping the baby. And trying to conceive, it hasn't been shown. There was a couple of rumors that were going around, which are unsubstantiated, that it can reduce your fertility. Absolutely not true. My personal example, I got the COVID vaccine in I was fully vaccinated in January. Fully vaccinated means that you have received the last dose and you've been 2 weeks after. So I was fully vaccinated in January and I froze my eggs in March and I got an astronomical amount. So clearly it didn't touch my fertility, but that's just me. This is an N of one or a study of one person. But overwhelmingly, if you look at the literature, which I did review a lot of literature. This is it's a vaccine that I am so confident in and so happy that is available because I think that's the ticket for us to get towards a future that might not be the same as 2019, but might be different, but doable because we're social creatures as human beings and we need to interact. And I really fear, and I want to put this plug in, I really fear for us in terms of the mental health impacts that this isolation has had, in addition to loss, death, mourning, loss not just of humans, but loss of normalcy, loss of income, purpose, because a lot of our purpose is tied in with our jobs. So I fear for us because I think that we need to prioritize mental health after this pandemic is over. As you notice, and this is an aside, but as you notice in the last couple of weeks, whenever you watch this, there has been a new outbreak of mass shootings. This is a reflection of the mental health status of us as a community.
And I guess this will be my last question because I know we're running out of time. With people getting vaccinated across the country, there seems to be a sense that it's safe to return to normal activities. And I know there are a lot of people wondering what the new normal will look like, especially when so many states already have or are beginning to open back up. What are some of the ways that Black people can stay safe to ensure that our communities don't go backwards?
I live in Texas. We wide open. Everybody outside.
Y'all close?
So I really want to put a plug in there. You can play in small groups, according to the CDC, with other people that are vaccinated without a mask, and you don't need to be social distance. But however, when you are in huge areas, even if it's not mandated, please, please, please keep the same preventive measures going. Wear your mask, social distance. Don't go to places you don't have to go that are mass amount of people. Making sure that you're still washing your hands, cleaning surfaces vigorously, and just staying clean, hygienic, and in some of a sense, keep your protective barrier around yourself. We used to call it the personal bubble, right? You remember that? So I think we should continue that until further notice. And no one knows what the new future or the new normal will be in the near future. I think we're all curious to find out what that would look like.
Well, thank you so much, Dr. Ruth, for taking the time to talk to me, taking the time to author these 2 volumes of the Black Patients Guide. I want to just encourage, in this discussion, by encouraging everyone to take a look out for our new Black Patients Guide that has this information and so much more that Dr. Ruth has put together. It's a resource for effective prevention methods, tips on how to navigate treatment, and updates on vaccine distribution. And you can read that guide at our website, www.theblackresponse.org. Thank you so much for stopping by to chat.
Thank you. Thank you for having me.